Good evening, ladies and gentlemen. Welcome to another program in our series, Living on Long Island. I'm your host, Joe Haynor. Today we will discuss a serious and sobering topic, elderly hunger on Long Island. You've heard that right. I am privileged to have two guests who will help me with this topic, and the audience could then learn something from it. They are Christine Deska, your Associate State Director, AARP.
Yes,
welcome.
Thanks for having me, Joe.
I have my card in my wallet. Gwen O'Shea, you are the President and CEO of the Health and Welfare Council of Long Island.
Correct.
Welcome.
Thank you. What
do your organizations do? Not only with this topic, but in general. Christine?
Sure. So AARP is a national organization, so we have a presence all across the country and even in Puerto Rico and the Virgin Islands. We mainly advocate for people 50 plus and their families to make sure that everyone can age with dignity and respect and find their real possibilities. That's our new tagline, Real Possibilities. So the reason why I'm here today is because we also have a foundation, and the AARP Foundation focuses on four main impact areas: hunger, housing, income, and isolation, and those are four major challenges that many older adults face.
So let's get the audience up to speed. It's not only AARP retired persons anymore. If you're 50 years and older, you're automatically a member.
Absolutely. At 50, anyone can become a member, even under 50, an associate member, and it's no longer retired persons, it's Real Possibilities, because think about it, who retires at 50 anymore? Who retires at even 65 anymore these days? Some people want to work longer, some people don't have a choice.
Great. Thank you for all you do.
Thank you for having
Gwen,
me.
just briefly tell me what your organization does.
So the Health and Welfare Council of Long Island is a private, nonprofit, 501c3 that was established in 1947, and we serve as the umbrella agency for health and human service providers, serving those really most vulnerable and at risk on Long Island. And that definition has evolved over time because Long Island's communities have evolved since we were established, and the needs have changed. Who makes up the communities, what are the needs in the communities have really evolved, and our focus is to make sure those that are most vulnerable have a voice and have access to all the different types of supports. We focus on access to health care, nutritional security, economic stability, and disaster preparedness, so that those that are struggling can get the resources that they need and have a life of self-sufficiency and self-sustainability. And we partner with great groups like AARP to really work collaboratively to address the needs of those folks on Long Island.
So the only people who could join your organization are people with a job, work there, or volunteers could help too?
No, we have members at every different level. So while our focus is really working with different agencies like AARP or North Shore LIJ or Island Harvest or Family Service League, we also have advocates, individuals like yourself that might want to get involved in the work that we do, because we do not just direct service, but also public policy and advocacy work to make sure there are the programs and supports in place for residents that are in need. We also work very closely with government, philanthropic donors, organizations like the United Way of Long Island or the Long Island Community Foundation, those that have a collective shared value and focus and vision to make sure that everyone, regardless of their age, their gender, their ethnic background, has equal opportunity to be self-sufficient.
Terrific. So at the end of the show, you'll give a number or an email or a phone number that our audience could join and help out both your organizations.
Absolutely.
Okay, now specifically, elderly hunger on Long Island. What is your organization role in combating this horrible reality?
Well, as Gwen mentioned, we partner with the Health and Welfare Council at AARP and other organizations as part of the Long Island Anti-Hunger Initiative. And I think I'll first just take a step back. I mean, hunger on Long Island isn't something people typically kind of hear or acknowledge as a reality, but it is. I'll just throw out one statistic. We know that over 50,000 people over the age of 60, or 60 and over, excuse me, on Long Island are actually eligible for the Supplemental Nutrition Assistance Program, but not receiving it. So we're looking at a large population of folks that are possibly struggling and not receiving something that could be helping them with their food budget. So, AARP partners with great organizations like Gwen's, the Health and Welfare Council of Long Island, to really let older adults know about what benefits are out there that could be helping them, supporting them and their families, helping them afford nutritious foods.
See, I'm learning too. What is the difference between what you said, is that SNAP?
Yep.
And food stamps?
So SNAP is the new name for food stamps.
Gotcha.
It's the same program, it's a different name. We advocated, along with many partners like the Health and Welfare Council of Long Island, to change the name from food stamps to SNAP. Unfortunately, a big barrier for older adults particularly, and being open to getting some assistance, is the stigma associated with food stamps, now called SNAP. And it's unfortunate because it's a benefit that if you're eligible, you should be receiving it if you're in need.
But,
and you're
again,
not taking away from any families in need by receiving the SNAP benefit.
So again, enlighten me a little more. Isn't food stamps a federal program?
Yes, food
So how is the state involved? Isn't the money directly from the federal government, or?
Yes, and that's actually a benefit for the state and the local economies. So it's a federal benefit administered by the state. So actually, when you receive the SNAP benefit and you spend it in your community, you're benefiting the local economic activity all around you. So that's an even better benefit for grocers, your local bodegas, wherever you go to do your shopping.
Okay. And what does your organization do in terms of this problem of hunger?
So our
Elderly
organization, as I mentioned, the Health and Welfare Council, we have sort of a hybrid of both direct service and advocacy and public policy. And I think it's important, Christine mentioned some numbers related to seniors that are eligible for the SNAP program and not getting it. I think it's also important for individuals to recognize that there's a real misperception about the type of state that Long Island is in and who makes up our communities and the needs of individuals within our communities. For the first time in history, poverty rates in suburban settings like Nassau and Suffolk County their growth have exceeded poverty rates in urban settings. And a lot of times there's a misperception. You live on Long Island, you live in Nassau County, you live in Suffolk County, everything must be going fine for you from an economic perspective. And quite frankly, that's not the case. As Christine pointed out, we have lots of individuals that are not accessing the program, but we also have a lot of individuals that are. So from 2007 to 2014, Nassau and Suffolk County saw a 200% increase in the individuals utilizing the program. And as you mentioned, Joe, it's a federal program that's administered by the state, as Christine pointed out, but it has an income guideline. So it's not as if you can just want the program and therefore be eligible to receive it. It's based on your income. So when we talk about seeing a 200% growth in individuals that are eligible, that speaks to the poverty need and the issue that many are facing, and a symptom of poverty is hunger. So what we do in partnership with AARP and other members is really try to break down some of the barriers that seniors may be facing. These are individuals that more than likely have worked their whole lives, may own a home, are living dependent on Social Security, but because of the high cost of living that we know our region has, like Nassau and Suffolk County, it becomes very difficult to pay for your utility bill, the gas in your car, and afford food. So we want to get out to individuals and say, this is a benefit that is rightfully due to you because you're eligible. It doesn't take away from anyone else, like Christine said. And it's really important from your overall health perspective to access that. So we literally help people enroll in the program, go through the application process, get the documentation that may be necessary, talk to them about how to utilize the card, because as Christine said, you can use it at a variety of different vendors throughout your community, big grocery stores, but also farmers markets and bodegas, because it's now like an ATM. So you have a card, so it also allows you to keep your business. So no one needs to know who's behind you in line that maybe the groceries that you're purchasing are being purchased because of your SNAP benefit. So we really want people to understand the benefit that this offers to them as a financial benefit, as a health benefit, but also as an overall economic benefit to the community, because for every $1 an individual spends in SNAP benefits, it creates $1.83 in economic activity for that community.
So ladies, your goal really is to eliminate the need for SNAP benefits, in a way.
Ideally.
You would hope
I mean,
nobody would ever need it.
That's a tall goal. You know,
Yeah.
SNAP is actually the nation's first defense against poverty and hunger. It is that line of assistance that's there, that baseline need for folks, again, that meet certain income guidelines. So it's a great safety net when one are in need. In the case of older adults, I think it's important to point out, and Gwen mentioned this, it's oftentimes, since folks are living longer, costs are rising all around them, it just becomes a basic math. You know, the income is staying the same, whether it's Social Security and maybe some pension or whatnot, but the costs are going up all around people. And many people are surprised to learn that they're eligible for some programs, including the Supplemental Nutrition Assistance Program, they never thought they would have been eligible for. But years and years go by and costs continue to go up.
Yes.
And suddenly, many people are eligible and unaware of that.
Let me clarify my point. I know people need it, but the object is eventually that they wouldn't need it because they have enough, and for some reason it's not working, so they do need it.
Right, it's a safety net program.
Yes.
So the idea with all of the programs that have been created at the federal level, Social Security, Medicare, Medicaid, the SNAP program, the idea is to have it be there at a point in time when you're in need. And hopefully that something will happen, transpire in your life, that you are not in need of that service any longer. However, what we know about the high cost of living on Long Island, stagnation in wages, because the program also is utilized by individuals that are not seniors, it's not as easy to use it for a temporary period of time because all the other external factors haven't changed.
Exactly. So if that'll be 10 more shows we start talking about Social Security. So let's focus on this today. You know, seniors are in. I mean, the world, I know there's a senior event in my town today, senior wellness programs. There's seniors in gyms all over now that we didn't have many years ago. And it's a humane thing to do to help the elderly. And it's also, they vote. Seniors vote. So the political leaders know that, so they help seniors. So we are trying to make life better for seniors in general. But again, there's a dark side, and that's senior poverty and hunger. Now, you mentioned it before, I just want to clarify this. Does poverty and hunger go together?
So, you know, oftentimes, if someone comes to us in need and they say they can't afford food, obviously it's tied to economic insecurity in some way. So we try to serve the whole person, and that's the wonderful thing about the Health and Welfare Council of Long Island. They're not only helping with one particular program, they're helping folks connect to benefits of many kinds. So oftentimes hunger and poverty do go hand in hand. It's the ability to afford the food that's needed. And for seniors, I really want to make the point, and our AARP Foundation is really stressing this now, hunger is a health issue. For older adults, not eating the proper foods, not getting the proper nutrition immediately transcends or transpires into something like diabetes, for example. A study was just released yesterday tying a lack of nutritious foods, the ability to struggle to afford good nutritious foods directly to something like diabetes. And where does that lead? Healthcare costs.
Right.
You know, it leads to many, many different challenges that an older adult shouldn't have to face if they just had the proper food and nutrition.
Now, when you say elderly hunger, what you have an age in mind? Are you clarifying it's 65 or 55? What is no definite? What do you classify as an elderly, hungry person? What age?
So for AARP, everything we focus on is people 50 and over. So we know 9 million Americans 50 and over are at risk of hunger, meaning they don't know where their next meal is coming from, and that's a staggering figure. Now, when you look at federal nutrition programs and how those classify people, they generally look at 60 and over as what they say, quote unquote, elderly. I know many people between 60 and 70 who would not identify with being elderly, but that's how our government and many federal programs classify, so 60 and over.
So Gwen, if a person, Christine said, I don't have enough to eat or whatever, that must shock you, but they do. Is the elderly hungry? Were they hungry when they weren't elderly? Did they suddenly become hungry, or is this a long-term thing and now they're elderly hungry?
Right, that's a really good question, and I think it points to the different definitions and the different categories of those that are poor and those that are struggling. I think that I want to go back to Christine's point and your question related to poverty and hunger and how are they related. And hunger is a symptom of poverty. It's when there is an economic crisis, either short term or unfortunately for some, it's chronic and it's long term, not having those dollars, those resources necessary to, from sort of a Maslow's hierarchy of need, to get to the first level, that the basics can't be covered. And so when a choice becomes getting my prescription filled or getting something to eat, most individuals are going to potentially maybe get their prescriptions filled or only get part of it filled, try to stretch that medication as long as possible. So now the issues become that much more complex. But your question about who is the elderly that are, what makes up the group that are utilizing the SNAP program, it varies. There are many individuals, I think, that have been trying for a long time. We take a look at what's happened on Long Island, since the major economic downturn. Home values have plummeted. Costs of everything else have gone up. To get by on Long Island, a family of four, whether you're a senior or whether you're 40 years old, a family of four needs $90,000 a year on Long Island just to cover the basic expenses without any sort of disposable income in case your car breaks down or in case you need an additional medication. So I think what we're seeing is because our population is aging, we are the oldest suburb, literally, in the country. Nassau and Suffolk counties both have two of the highest percentages of seniors. As life expectancy grows, our population, our senior population, is only going to continue to grow. And without that change in wage, if there are no other resources coming into the household and all other costs are going up, we anticipate to see this being a continued growth in terms of seniors accessing the program, which is why it's so important that we work together. AARP has a great rapport with this population. It's a trusted name. It's branded in a way that, working with folks like us on the ground, we can really help break down some of that stigma and really make sure that people have the resources that they rightfully do.
50 years ago, they launched the War on Poverty. I was privileged to go to the city to see all the way the story of LBJ when Bryan Cranston did it. And the War on Poverty was a terrific idea. Nobody mentions it anymore. People seem to run away from it. It didn't work and all that. Did those poverty programs 50 years ago, did they help? Is there still lasting help on Long Island because of those?
Absolutely. Long Island was created with, the GI Bill. When you take a look at how we became the first suburb, people forget that folks that, say, oh, I don't want government involved in this, or government is using dollars in the wrong way. It was a major infusion of government dollars that allowed people to get mortgages, to get a higher education. Less than 20% of those dollars were used for unemployment benefits. People used it for all other aspects to help them become self-sufficient and sustainable. And so the GI Bill was an unbelievably huge success in terms of being an anti-poverty initiative. The Social Security, Medicare, and Medicaid, also extremely important anti-poverty programs. I think part of the challenge is that a lot of our anti-poverty programs have been sliced and diced over decades, and the investment is not at the level that it was then, especially when we take a look at, again, our populations. Social Security was created when life expectancy was almost 15 years less than it is now. So, we have to rethink how some of those policies work, but I think absolutely they've been successful.
You mentioned hunger on Long Island. Poverty on Long Island is among the elderly, is that high also? Then?
Yes, as Gwen said, and Gwen put it perfectly, since hunger is a symptom of poverty, as one rises, so does the other. When we serve an older adult, when they come to us with challenges, it's not just one challenge. There are many, many issues at play. There are the challenge to pay for housing, prescription drugs, utility bills. Actually, AARP is fighting a lot to kind of control the rising utility costs on Long Island, because if we're talking about someone who is unable to get back to work or already retired, there really isn't the opportunity for them to increase the dollars coming into their household at that point. And that is why the programs that Gwen just mentioned, Medicare, Medicaid, Social Security, the SNAP program, are all so vital for older adults, especially now more than ever.
So doesn't the government have a certain dollar figure
Right.
of what it is to be poor?
Yes.
You're saying even if someone on Long Island is above that figure, they could still be in poverty?
Absolutely.
Because living here is so much more expensive.
The federal poverty level
Absolutely.
for a family of four is roughly $24,000 a year.
24,000 family of four.
24,000. Now, I just said 90,000 to cover your basic expenses. Basic expenses. Again, that's not, I worked late and I'm just going to pick up a pizza on the way home for my kids or for my grandchildren if I'm taking care of them. There's no disposable income in that number. And so the challenge that we see for our senior population as well as all populations is the difference between that two. And how does that need get met? Because if you're over, you're not considered poor. But clearly, if you're under the 90,000, you're struggling to make ends meet. We know on Long Island, we have, I think it's about almost 25,000 seniors that are at or below the federal poverty level. 25,000. But we know there are many more that hover just above it based on their Social Security or the limited pension that they may have. And again, when we take a look at the cost of living, it's an ongoing daily struggle for the senior population.
Before we leave just this topic, and we're going to continue it, but I just have to throw this question in. Are the elderly becoming more, in terms of more poverty stricken because their families are not taking care of them as well? Or is the government not doing it? Other things not doing it? Why did we seem to have it now? We didn't have it 10, 20, 30, 50 years ago. Were their families taking it upon themselves to help them? Do you see that the family is casting off, I hate to say, the elderly people?
Well, I would just say that challenges grow exponentially when an older adult does not have family support or an advocate to help them along the way.
So because we're living longer, that's automatically going to cause...
And I would point to just the overall cost of living rising so rapidly, whereas older adults now could have been retired for 20 or 30 years and still maintaining a very, very slow rise in income. And of course, they're going to be struggling over time.
Right, and two other pieces I think that play into that. You know, you said, why is this different than it was 10 or 20 or 30 years ago? Our population has changed. They are aging, you know, so we're in a different, you know, the baby boomers are not the baby boomers any longer. They're now, you know, aged into the group of senior definition. But the other piece is because of the high cost of living, like Christine pointed out, we've seen a huge shift of that generation of caregivers off Long Island. Because as their children were graduating from college and they were looking to find employment and they wanted to find a place to live, they couldn't do it here on Long Island. One, because the housing stock is so limited. We have a very small rental market available for individuals. Even what is available is very costly. And as a suburban community, it doesn't necessarily meet the needs of that population any longer. So they move to more urban settings or other suburban communities where you have more sort of developed downtowns and other things to attract that generation. So for the senior population, many of them are isolated and they are left on their own to navigate this very, very difficult, complex time that they're living in.
Does poverty go across any racial lines? It's all? It's not focused on minority population or anything? And how about gender?
Well, unfortunately, what AARP knows from our research is that the Hispanic Latino population, the African American, Black, Caribbean population are disproportionately affected by hunger and poverty. Another population that's disproportionately affected are single women, widowed women. You know, you're on your own with one income. I mean, the reasons are probably self-explanatory in that case. So yes, there are populations that struggle more so than others when it comes to hunger and poverty.
An organization I'm familiar with, I've worked with in the past, is Meals on Wheels. They've done some great things. I'm just going to read you something. 15.8% of Americans, nearly 50 million individuals, are still struggling to afford enough food to lead healthy, productive lives. In the richest, most agriculturally productive nation on earth, it should stand as a point of national shame that we have any household struggling to put food on the table at all.
Well said.
I'm going to, authors from Meals on Wheels, Aiken, Hollander, Nelson, Marsh, Ryerson, I want to give them credit. They wrote an article and it says, "Past time to solve hunger in America." Mm-hmm. So in the richest country on earth and of the most developed countries in the world, I believe our poverty rate is the highest. So that is a national shame.
It's
It is.
shocking.
It is, and you know, Christine brought up a point which I think speaks to part of this, which is we have to understand and recognize how interconnected all these issues are. So while one may say, well, let's just raise the SNAP benefit or make it even more accessible for individuals to get into, that's one piece of the puzzle as it pertains to addressing the issue of poverty, not just here on Long Island, but in the nation. But there are ways that we know we can address it. There are policies and programs that have shown to work in the past. We know that the SNAP program is unbelievably impactful now. It's a matter of, is there, quite frankly, the political and community will to move change?
I'm going to, on a subsequent show, I'm going to talk about this, some solutions. But this article again says, hunger in America is a solvable problem through the collaboration of government, industry, nonprofits, and generous individuals, but we must do more.
Absolutely. I mean, Gwen mentioned that both of our organizations do quite a bit of macro level work, advocacy work to really push the envelope and support many recommendations that will help older adults and beyond in supports. And I think it's actually the AARP president, Lisa Marsh Ryerson, who's one of the authors of this article, so that's very appropriate. And as I mentioned earlier, hunger is a health issue. When you look at it that way, how could we not support our older adults who are in need of healthcare services? Well, that's the direction we're pushing folks when we don't support programs like the SNAP program that we know is effective in combating hunger.
What does elderly hunger look like? What could you describe that in a short? What, you know, and you must see it. What does it look like to you, or what would it look like to the viewers?
Well, I think that's what's interesting is there is no look. There is no particular person you could see walking down the street and say, oh, that person must be hungry, quote unquote. It's anyone. It's my grandmother. It's your mother. It's your aunt, your uncle. It's anyone, because when it comes to older adult hunger, again, when someone has retired thinking they need a certain amount of money and their life expectancy ends up being plus 10, 15, 20 years more so than they had planned for, the costs around them outweigh the income coming in to such an extent that support is going to be needed.
Do they know it's coming? I mean, is it one morning you wake up, I'm hungry? Do the people who are getting this at this point in their life, do they see it coming for weeks, months? Are they starting to make choices? It's either medication or this, but is it a gradual thing, or is it just, it happens?
I think I want us to look at it as it's not always necessarily a bad thing, right? Because there are some individuals that they've worked their whole lives and they, you know, have a modest income that comes in from Social Security, and this fills a gap. Right? It helps purchase fresh fruits and vegetables. It helps cover that additional cost that they may have. So we want to make sure that everyone realizes that they may be eligible for it. But I think to Christine's point, when you ask, you know, who looks, what is the look of it? I mean, it's you. You know, it's an individual that is our neighbor. It's everyone. There's no, you know, we would like it to be so definable, but the reality is anyone at any point in time could be potentially benefit from this program based on their income. And I think that individuals perhaps stretch it as far as they can, and that's why it's our hope to get to them and talk with individuals about the availability of this program before they get to a point where they have sacrificed their medication for a month, or they have gone without food for a month.
Anything else? We're just going to lock this up. Any other points?
Well, you know, I'd just like to mention, if anyone's listening who knows someone who might be in need.
Could you hold that to the second show?
Sure. Oh, sure.
Interrupt me again. That's one of the questions we have to answer.
You got it.
I want to thank Christine very much. We're going to do a follow-up on this very soon, and I thank you for coming.
Thank you so much.
And Gwen, I want to thank you also.
Thank you for having me.
Ladies and gentlemen, I want to thank my guests for a thoughtful and necessary discussion. Let us all do our part to solve this heartbreaking problem. Also, my thanks to SUNY Westbury for the beautiful studio, and to Sherry Baker and the terrific crew for helping us out today. Until next time, this is Joe Haynor wishing you a good night and a better tomorrow.